Hello, thank you very much for joining us today on the program Healthy Living. I am Adesua Osauwagie. Today we want to make you understand something. And this thing happens only with men, only with men. What are we looking at? We're going to be looking at understanding prostate cancer. And I know that a lot of persons do live in self-denial. Most men want to be men. They don't want to come out to say that, you know, this is what is happening. There is no man, if you know what I mean, man in quote, when it comes to your health. You need to go to the hospital. You need to see a doctor. When you do not understand yourself anymore, the next place to go to is the hospital. Not one home or the other where you'll be given so much concussions that you don't know what you're taking. You might just be compounding your problems. So what is prostate cancer? How do you know that you have it? When do you know that you have it? What are the signs and symptoms? Does it kill? At what point does it kill? What are the risk factors? This and many more we are going to be looking at on the program today. And of course, you can call in. Yes, call into the program to ask the doctor questions. So join me as I make welcome Dr. Orale Osula, a public health physician, and she's the Chief Operation Officer of Reta Consult here in Benin City. So, Doctor, happy to have you join us.
Thank you very much, ma'am.
And you're looking rather very smashing today, you know?
Too, my dear.
Okay.
Thank you very much.
All right, Doctor. Let's look at what this prostate cancer is. What is prostate cancer?
Thank you. First of all, what is the prostate?
Okay.
The prostate is a gland found only in the male reproductive system. So that implies that what we're discussing today, women can be affected by it. Their main concerns, yes, their main concerns should be because they have brothers, they have fathers, they have spouses. So it's also important for women to know about this issue.
Okay.
What happens for prostate cancer? It is abnormal growth of the prostate gland. It's a normal size when you don't have any of the symptoms.
Is it something one can see,
it's located
or is it inside the
within
body?
the body. It's somewhere close to the urethra, that's inside the male reproductive organ. It's hidden. You don't see it. So that's one of the reasons, in fact, people don't know much about it. It's not something that you see and, oh, I have a swelling or stuff like that. You have to have certain symptoms for you to say, okay, I'm going to see a doctor. This may be a problem related to the prostate. So prostate cancer is an abnormal growth in the prostate gland.
Okay, so how do you know? What are the signs? What are the symptoms? How would one know that, okay, this sign I'm feeling is prostate?
Okay. Symptoms, that's what the patient complains about. Some of the first things this patient will begin to talk of is, I get up frequently to urinate. I get up a lot. We know that this is a symptom which people who may be on drugs for hypertension may be complaining about. It may also be a problem of diabetics. So it's important that we go to the hospital when we're having symptoms. But first of all, as a man, if you say, okay, I get up a lot at night, to doctor, I know they sleep. I don't sleep as well as I should. I have to get up every time to go and urinate. That's one symptom. Secondly, do you have a problem with the flow of your urine? You know, children growing up normally have that competition where they say, whose urine goes the farthest? Yes. So as an elderly person or as an older man, there are times when you begin to notice this thing doesn't flow out as much as it's supposed to flow. You should begin to worry that something is going wrong. Sometimes the men will tell you, doctor, I have to press for the urine to even start. And even for it to flow, there are times where I still have to strain. That straining, men will understand this. When you have to strain for you to start urinating, and then even to complete it, you strain. That is one of the symptoms that should tell you something is going on with my prostate. There are a lot of other symptoms. There are symptoms where intermittency, like I've described, apart from the straining, even if he's not straining, he notices I start and I stop. I start and I stop. And after all this, there's still the feeling of incomplete voiding.
Okay.
The bladder is not empty. You're worried like, I just went to the restroom now, but I still feel as if there's something. That is something that should take your mind to, something is happening, I need to see my doctor. There are several other symptoms. Even blood in the urine. This may be a symptom, yes, for urinary tract infection. Okay. However, it's important that you go to a hospital. We are trying to get to the point where we discourage people from just going to the chemist or going to all these women who sell concussion. In fact, recently there was a picture I saw. The woman had a bowl of all sorts of things mixed on her head, and she was wearing a uniform. So it's almost like people are beginning to give these people so much respect that they feel they should be recognized. And it's wrong, because you never know what is really going on except you go for testing, except you go for checks. These are some of the symptoms that if you are possibly having anything related to prostate cancer, you may begin to have.
Is it not possible that these concussions may help?
Not at all. The reason why I totally disagree with this use of concussions, we are very used to let's try and use our own native things. However, we don't know the specific doses they come in. We don't know what is used to make them. We've seen cases that these concussions are toxic to the kidney. They're toxic to the liver. There are other systems that are being affected just by these things people take. However, you don't know all the problems that have arisen from it until later. They say, at a time, I was taking this and taking that, and you say, oh, this is probably the reason why we are having these symptoms. So please, it is advised that you stay away from these native concussions. They have their own side effects.
Okay, women want to ask the causes or cause of prostate cancer.
Okay. Prostate cancer, the cause hasn't really been found. It is unclear. Nobody can tell you this is the specific thing that causes prostate cancer. However, we know risk factors. We know what are the things that put people at risk of having prostate cancer. Okay. Like we said, first of all, being a man. That is not a modifiable factor. It's not something that you can change. You're a man, you have the prostate gland, you are at risk of it. Secondly, your age. Okay. It's been found that as men advance, especially from the age of 40, it's the likelihood, the chance of having prostate cancer increases. So this brings us to the point where men from 40 need to get themselves checked. They need to go for screening. They need to begin to ask, how do I know my prostate is okay? A lot of times, because it's something that is not seen, and men don't particularly like to go for checkups or complain that anything is happening until it's really bad. Most men can attest to this fact. Unless it is a critical problem, they'll tell you nothing is wrong with me, I'm a man. Unfortunately, that makes a lot of them present very late. Late presentation is one of the reasons why they come down with all the complications that they have, and why prostate cancer can be so deadly, why the complications are so much. So like I was saying, for this, age is a factor. From 40, men are to screen. We found out that 65% of the cases that occur for prostate cancer actually happen from the age of 65 years. However, you don't want to get to that point where you're coming down with symptoms. It is important that anything is picked early to ensure that you're treated early enough to avoid any complications.
Is it curable when it's detected on time or when there's an early presentation? Yes,
there is a treatment for it. Usually the final treatment is that the prostate gland is removed. You take away what is causing the problem.
Would that not affect fertility?
As part of the counseling before such operations, the patient is told basic things that can be done to ensure. Given the fact that most of the time these cases occur late, we expect that some of these men have completed their family size. However, because of urbanization, industrialization, the economic situation, some people are still in the process. So if you still decide that you want to have children, there are things you can do. Okay. You can store your sperm before the operation is done. However, it's only a living person that can even begin to consider having children. So you can't say you will keep what is causing the problem because you want to be fertile. There are things that can be done.
All right, still on this risk factor, doctor. We've talked about age.
Yes.
We've talked about being a man.
True.
And what else?
Other risk factors. Obesity.
Okay.
You see, sometimes people look at being fat as a sign of affluence. Some of them are genetic, yes. Some people are predisposed to being on the big side, but there are people who you've known over the years to be very slim people. And after a while, in quote, they start to chop life. They are big boys. Yes, when you become affluential and then you feel no more exercising, you eat anything, you eat late, those things can put you at risk of beginning to develop prostate cancer. In addition, a family history of prostate cancer puts one at great risk. So any patient who comes and says, my father had prostate cancer and in fact we had to do the operation, by the time that man is 40, it is essential that he begins to check regularly, because we've seen that familial history puts a patient at a higher risk of having the condition, unlike others without a familiar history. So these are some of the risk factors.
So at what point does it result to death?
Okay, because this prostate cancer is a slow-growing cancer, what we find is the mortality is not necessarily so high if it is detected. Okay. What happens and why we encourage, like I said, early detection is we don't want to get to the point where the patient is presenting with complications such as inability to move, urinary retention, all those things, because there may be metastasis to the spine, there may be metastasis to other areas that now lead to those complications that may lead to death. But if you screen these patients and you detect it early enough, we shouldn't be getting to the point where prostate cancer is killing someone. Yes.
All right, and is it not possible for somebody younger than 40 to have it?
What we have seen is that this is rare. It is rare.
But it's possible.
It's a possibility, but it's rare. It's rare. We advise, because the cost implication of running screenings for people less than 40 years are not eventually beneficial. What we want is from 40, this is what research has seen, this is what the studies have seen. We're not saying it's absolutely impossible, because there's really nothing impossible in medicine. However, if you're having symptoms at 35 that are in keeping with some of the things that we have mentioned, it takes nothing from you to walk up to the doctor. I would like to run a test. I would like to be examined. I want to know what is going on. And then you can be treated appropriately if the diagnosis is made.
Okay, while we're discussing on Thursday last week, somebody sent in a text message to say that he didn't have any symptoms. You talked about symptoms, he mentioned all the symptoms. I said he never had any. Okay. He came down one day with malaria. He thought he had malaria, went to the hospital. No, he went to the hospital after like 3-4 months without really getting well, only for him to be told that he has prostate cancer. Well, is it possible for one not to present symptoms, not to have symptoms at all?
I cannot say is my word against his now, because sometimes some symptoms present so mildly that it may be overlooked. So for example, really if the weather is cold or like rainy season where you feel it's normal to get up more than usual to urinate, or because the weather is cold, you may overlook certain things that are happening. So the good part of this is he was still able to be diagnosed before it grew into something like an emergency. However, a lot of times the essence of this program is to let people know if you're having anything that seems like a symptom, anything at all. In fact, we found out that sometimes people self-diagnose and self-treat. That leads to late presentation. It's a normal thing if you go to the hospital, you are clecked. Clecked means you are asked various questions regarding all the different areas of your body, from your chest, your digestive system, your urinary system. You want to know, is this person having anything? So there are times where if a doctor sees you and he knows what he's doing, it may even be an incidental finding. They may find some history from you and they say, okay, let's run 1 or 2 tests. Let's just see. But a lot of times, because we feel malaria is endemic in our environment, you just go to a pharmacy, you treat. We've seen a lot of that. People self-medicate, and when they now start having complications is when they present to the hospital. And it's unfortunate because the doctor is still not a magician. The time you spent self-medicating, we could have made a diagnosis and already instituted treatment at this point. So that brings us to the point of self-medication is bad.
Perhaps because going to the hospital is like very expensive for a lot of persons. They see medical services as quite expensive. That's why they self-medicate and just visit one chemist or the other, or pharmacy or the other. A lot of us do it. You go to some pharmacy shops, you see so many people buying drugs without prescription. Yes.
However, this is a case of being penny wise and pound foolish. Because some of these patients, some of these people end up spending a lot more than they would have spent if they were in the hospital. We've seen cases of people who don't even get actual treatment for the symptoms they present with. When they bring out their bag of drugs, because that's usually how it is, they give them this, and this, and sometimes they may even have the same drugs, different brands. So when you bring them out and you say, Madam, now, is it all this that they gave you? You say, yes. The patient tells you yes. The actual treatment for what he's complaining about that took him to that pharmacy in the first place is not even there. And when you compute the amount of money that this patient has spent to even purchase these drugs, it serves no purpose to have gone to the pharmacy in the first place. At the end, in the long run, it's a lot cheaper to see a doctor from the onset. The other reason is some of these drugs mask the effects. Mask the symptom. You don't actually get a proper presentation when the patient comes later. So at that point, you will now only have to take a history, try to find out some of the initial things. By the time you're examining, you are really not getting classical signs that you should see in a patient like this. However, because the patient has taken all sorts of drugs, you can't really get anything clear. In fact, now we're battling antibiotic resistance because you see someone being given ciprofloxacin. We don't call specific names. You see someone being given strong antibiotics in quotes. Strong antibiotics, that's what they call them. And then this is supposed to be a last resort. This is supposed to be something at the end of it. When the patient comes to you, this is a drug you should have done one or two other things before finally prescribing this drug. The person has taken it already. And sometimes they take 2-3 doses and stop.
That's quite sad.
So when you need the drug to work, you end up not having that effect that you really want to get for this patient.
That's quite sad.
Yes.
All right, you're watching the program Healthy Living on Independent Television. And what we're doing today is for you as a man to understand what prostate cancer is, so that you will know how to take care of yourself and where to run to. Our lines are open. Give us a call on 052-290-573. Dr. Ogale Osula is here to answer all of your questions. Now, let me do this. Shame, no day for inside. Just call the doctor, okay? Call the doctor, ask questions. If you are experiencing 1, 2, 3, or 4 of the symptoms, then give her a call so you know what to do. Doctor, is it possible for one to experience 1, 2, 3, 4, or all of the symptoms? Or is it just one at a time?
It's possible. It depends on how the patient is presenting. We don't put a limitation on the number of things the person can come down with.
Okay.
However, we don't expect you to wait till you have so many symptoms before you finally come to the hospital.
But you know that in this part of the world, we have to wait. So maybe that person is not able to move again. They say, oh, this person is really sick.
It's a serious matter.
And then some people have this one say, they don't get me. They don't get me. You
That's
know?
True.
They don't get me. That is the point where people rush to the hospital.
And we don't want that. We counsel against that because there are a lot of things that can be prevented. Prevention is better than cure. It's better for you to avoid all these complications, avoid these symptoms in the first place. Once you see one, you don't need to wait. It's better you come to the hospital and they tell you, Oga, you're too scared or you're getting too worried over nothing, don't worry, go home, than to wait 1, 2, 3, 4 symptoms before you present to the hospital.
Wow. Now let's look at the test for prostate cancer. How is it done? Is it difficult? Is it, you know, is it just like an everyday thing? Because one thing, people are very scared. They don't want you to pierce them. They don't want any form of needle. You know, they don't want you to, like, you know, just do something extraordinary, something they cannot stomach. Is this something one should be scared of? Something a guy should be scared of? Well,
at this point, you tell the patient to man up. We are trying to make a diagnosis. It's just a simple blood test first, and a physical examination. The blood test
examination, you have to put your hands into the patient, or you know, we want to know all of this.
Yes, okay. We do 2 things at the onset. One is called a digital rectal examination. The way to palpate, the way to find out the size of the prostate, the description of the prostate, is it rubbery, is it hard, is it giving us any sign that something is going wrong, is it bigger than it should be? We need to put a finger in the rectum and check. That is the only way to go.
Doctor do that?
You see, at such points, I don't think the sex of the doctor is an issue. It shouldn't really matter. My expertise is what is important to you.
Please sound it loud and clear.
Not whether I'm male or female. It shouldn't be an important issue if you're a man or a woman. Your own issue should be, how do I get well? How can I be okay? Secondly, when we want to run a blood test, we do prostate-specific antigen. Prostate-specific antigen. When you do a prostate-specific antigen, there's a particular level we want your result to be, to range between. If it's above that level, it raises a red flag that something wrong is going on. So at this point, we begin to take other steps. These are the issues related to the prostate are for specialized doctors. But to start with, the digital rectal examination and the prostate-specific antigen test are the 2 ways to go first. If we want to investigate a patient.
Let's look at treatment and side effects. What's the treatment like?
For the treatment, there are different types of treatment depending on the extent, let me say the extent of the enlargement, or what is the final diagnosis. This because there's benign prostatic hypertrophy. In this one, there's no cancer cell in quotes. It's just an increase in size. However, some of these enlarged prostates are malignant. So at this point, you will want to say, this thing has to go. So for treatment.
Doctor, let me hold you there. Hello, caller, good afternoon. Hello? The number is 052-290-573. It's on your screen. We expect you to call as a man. You know, man up and call us, Man up and call. Ask a question. Hello, caller, good afternoon. Yeah, tell us your name and ask your question. Dr. Osula is here.
This is Frank, calling from Edo State.
Frank, how are you?
Fine.
Go ahead with your question.
I have an issue of a pulse.
You have issue with what?
Pulse.
I didn't get that part.
Yeah?
Can you speak up a bit?
Pulse.
You have an issue with what?
Pulse.
Sperm. Pile. Shame not the inside now. Just speak up a bit so that we can hear you. You have an issue with pile. What's the issue now?
So I've been taking the
hello?
I've been using traditional herbs.
Traditional medicine, yes. We are actually not discussing pile today, even though you've been giving traditional medicine. I think your best bet is to go to the hospital, see a doctor, and see what can be done for you. Abi doctor, no be so.
Yes.
All right. So go to the hospital, see a doctor. You have used traditional medicine, it's not working for you. Go and see a doctor. Hello, caller. Good afternoon. The topic we're looking at today is prostate cancer. Understanding prostate cancer is what we are up to today. Hello, good afternoon. Hello?
Good afternoon.
Good afternoon. How are you? Tell us your name and ask your question.
My name is Destiny.
All right, Destiny. Destiny, ask your question. Okay. Hello?
I'm getting
Okay, ask your question. The thing is this, you need to call us and then speak very loud. Hello, good afternoon. Reduce the audio level of your television set, please. Good afternoon. Tell us your name and ask your question. Can you do me a favor? Move away from your television set.
I'm not on my TV.
Okay. But the echo is so much, I can barely hear you. All right, go ahead with your question.
I want to know if the prostate cancer is curable.
If it's curable.
Yes.
Okay.
Thank you for your question. Yes, it's curable. We've answered that question already. It's curable because you remove the prostate. You remove what is causing the problem. If you do that, you won't be at risk of having prostate cancer. What happens is, it's called the prostatectomy. You remove the prostate, which is the offending agent. This is what is causing the problem. And yes, you can be cured.
All right, I'm sure you got that. 052290573 is the number to use, and I'm sure that number is there on your screen. Doctor, while we're waiting for calls, we're looking at treatment and, of course, the side effects. You know, what kind of treatments are open to this, to any patient with prostate cancer?
Okay, apart from this surgical treatment, there's also radiotherapy.
Okay.
People are not very keen on that, really, because they say cost and other factors. And in this, our environment is not even easy. It's not so easy to actually access these facilities. So we deal usually with the traditional method of removing the prostate. Those are the two main things that is used to manage this condition.
What are the side effects?
For the side effects, one, for every operation, there may be bleeding, which is normal, is like a complication of the surgery. Okay. Okay. But for some people, there's the problem with fertility, because the prostate gland is actually involved in production of seminal fluid. So, this is why we counsel patients to store their sperm. If they still want to have children, or if they haven't started having children, you store their sperm. For some people, there is erectile dysfunction. This comes up and says, okay, the man may not be able to perform as before. However, it's not a very common complication. It's just, we just have to inform the patient that it is a possibility. Okay. That's after the surgery, no? After the surgery, yes. Some men may already have potency issues, and then following surgery, they come and tell you, I don't perform as well as I used to. This is, we counsel them. It does not always happen, but it's best that they know that this is a possibility. However, if you are dealing with a situation that is threatening to life, that is threatening to your well-being, I think the benefits of the operation outweigh the risk and the side effects. In some patients, you may also have what they call retrograde ejaculation. This is the sperm goes into the bladder, goes back. Instead of coming out forward, it goes back into the bladder and comes out with urine. Some men find this very distressing, which is one of the reasons we also take time to talk to patients.
Wouldn't that cause any problem to the man again? Instead of the sperm to come out, it goes back inside. Would it not?
No, it comes out with urine, comes out in the bladder. It's not like it's going to stay in his body or enter his system. It's still going to come out, but it's like, in quote, coming out with the wrong things instead of just coming on his own. You have to inform the patient to know.
Doc, let's take this call. Hello, caller. Good afternoon. Hello. Hello? Hello, I can hear you. Okay, I guess we lost that call. 0522905573 is the number to call us with. Okay, Doc. Hello? Hello, good afternoon.
Hello?
Hello, good afternoon.
Good afternoon.
Please tell us your name.
My name is Pastor Daniel.
All right, Pastor Daniel. Welcome to the program. Please ask your question.
A few years ago, my father was having this problem.
Okay.
And because we were able to discover it on time, and he died.
Okay.
Right now, whenever I'm trying to urinate,
Yes.
sometimes I force myself and I pause.
Okay.
I pause and I pause. Is there any drug I can take to flush this thing?
Okay. All right, he's asking if there's any drug he can take to cure this, because each time he wants to urinate, he press and force himself. There's a history already.
Yes.
There's a history already.
Yes.
So we don't do drugs on the program anyway, but doctor, I'm sure you have something to say to this.
My best advice to you is to see a doctor.
Okay.
Like we said, we already highlighted risk factors. Family history, you've already said your dad passed because of this
it was not discovered on time.
And now you're already having one of the symptoms we mentioned. And if we were to have the opportunity to ask 2-3 more questions, clearly they may be yes. It's important you see a doctor. That's the best advice to give at this point. The doctor can decide at that point, okay, sir, let us watch for a while. You may do a PSA. It hasn't gotten to the point where, okay, there's a problem. We know what to do. The first and most important thing is for you to go and see a doctor. They are specialists, and they are also men. If you have reservations about seeing a woman, there are also male doctors who deal with these issues. So going to see a doctor is the best thing to do at this point.
When you tell somebody go and see a doctor, it begins to wonder, what kind of doctor am I going to see?
Oh, these specialized doctors are called urologists.
Okay.
What happens is, if you go through a good process, if you go to a good hospital, if you go to a tertiary hospital, you can be directed to these people. Okay. The attention is drawn to your matter, and there are specific days where you can see them, and your issue is handled with the best hands.
Okay, hello, caller, good afternoon. Hello? Hello? I can hear you. If only you will reduce the audio level in your television set, everything will go smoothly. Hello, good afternoon. Hello? Okay, when you are calling us, please, just observe the simple rules of reducing the audio level on your television set. Hello, good afternoon.
Good afternoon. My name is Efosa.
All right, Efosa, how are you?
I'm fine.
Okay, ask your question.
There's a question I want to ask.
Go ahead.
Issue of sperm to when man wants to meet the woman. Sometimes they will say he has a low cancer. How the low cancer look like? Is it something like watering, or I don't really understand that area?
That low sperm count.
Yes.
Okay, even though we're not doing fertility today, doctor, quickly give him an answer. I think he needs an answer urgently.
Low sperm count. When a sperm sample is examined, there are specific things we look for. Motility. How fast do the sperm cells move? What is the viscosity? How thick is it? Is it light?
Okay.
But it is important for you to have a certain number of sperm per mil to be able to impregnate a woman. If you've done a test and you've been told you have low sperm count, there are things to be done. Okay. What you need to do is to see a specialist.
He wants to know if, the sperm doesn't look watery, like he thinks it's something you can see with ordinary eyes as, this sperm is watery, this sperm is thick, or whatever is white, is greenish or yellowish, You just want to know. You want to understand how to,
you have to do a test to be able to know if your sperm count is low or not.
You must go to the hospital.
You must go to the hospital.
Okay, first I hope you're hearing that.
Yes.
Okay, so you go to the hospital. It's not something you can see with your ordinary eye. Hello, caller, good afternoon. Hello, good afternoon.
Good afternoon, madam. How are you?
I'm very fine, thank you. And you?
Fine.
Okay, tell us your name and ask your question.
My name is Patrick.
Patrick, okay.
Yeah, I'm speaking from Ikorodu. I want to ask the doctor, the fine doctor.
Please, ask the fine doctor.
I came in the middle of discussion.
Okay.
But I want to find out the symptoms of this
prostate cancer.
I want to, I'm sick right now. See, working, I'm never retired.
Okay.
I want to ask some questions.
Okay. Ask the question now.
Yeah, before now, I don't drink. I'm a sportman also. I work, I'm a sportman. I teach the bando in police college.
Okay.
And recently, if I drink beer, I go to bed tonight, maybe 2 or 3, 4 bottles. I go to eat myself more than necessary. So, is this part of the symptoms of what they're talking about? I want to know.
Okay. So he came in the middle of the program. He wants to know the symptoms of prostate cancer. Hello. You want to know the symptoms and what else?
Yes.
Okay. So let's...
Symptoms?
Yes.
Okay. You're welcome to the program. For prostate cancer symptoms, one, what we said, the patient may, the client, the person may begin to have frequent urination, getting up at night several times to urinate. You have to do a test to or eliminate the fact that this person is on BP drugs or maybe has diabetes or any of all these other issues. You may also have problems with the flow of your urine, how far you can go. There's also frequency. Frequency means you have to urinate several times. You have to go to the loo several times. There's also the issue of straining to urinate. You have to force, you have to use pressure to urinate. And even at that, the stream seems to cut off. It stops and starts and stops and starts. These are some of the things. Even blood in urine is a symptom, can be a symptom of prostate cancer. These are some of the symptoms which we already mentioned. Okay, you want to ask further questions? Hello, caller. Patrick? You want to ask further questions?
I'm listening to the doctor now.
Okay, she's done telling you about the...
I want to ask that. See, I so much appreciate, I so much appreciate what you guys are doing, but I want to say something.
Okay.
I want to say something.
Please say it.
Okay, there was a time I had an HMO I'm attending. There was a time I was admitted for malaria and typhoid.
Okay.
The doctor diagnosed, and instead of treating me, and he kept me a whole treatment. The thing was causing me headache and whatever.
Okay.
I was unconscious.
Okay.
So, in fact, they said something like the medical is the fan of my head and that I had called that, which is a lie. After that, if they took me to General Hospital and looked for operation. God saved me and there was no chance. If I to go for that operation, I wouldn't be alive today. Okay. So doctors to actually do their research and test very well before decide to now bring treatment for patients. Okay,
thank you very much, Patrick. The more reason why you should go to a certified doctor, okay? We're not talking about, you know, there are so many doctors everywhere, but go to a certified doctor, go to a good hospital. You will know when you say a good hospital, okay? All right, people, 052-290573 is the number to call. Call the doctor. When she leaves, I don't have answers to your question. I will not have answers to your questions, okay? So just call the doctor. Let her give you all the answers you need on prostate cancer. All right, doctor, let's talk about the side effects again before we go to management. Somebody who is already living with it, how is that person going to like manage himself? Okay, the side effects of prostate let's do cancer. Side effects again. Yes, because somebody sent in a message a while ago that he missed the side effects of treatment. Side effects of treatment. Yes, okay. And then he asks, is chemotherapy part of treatment.
Yes. Okay. Side effects of prostate treatment for prostate cancer. So like we said, this hemorrhage, I mentioned hemorrhage, which is one of the complications of the operation which is done. But some of the side effects...
For how long without
No, it's an operational, it's like an immediate complication. It's not like you're going to continue bleeding. It's going to be managed.
Exactly where is the operation? That's exactly where is the doctor going to cut?
Okay.
I'm just trying to like wonder where. Is it the stomach?
There are different ways people come in. There's one which is called transurethral resection of the prostate. They pass through the ureter.
Okay.
Modernization technology has advanced, and we try to look for the least invasive way to get to that organ to do it. If open prostatectomy, when you have to make an incision on the abdomen, we really don't, we try to avoid that now because there are better methods. You have to go to a specialist.
So men should not be scared.
You shouldn't be scared, because for a person to do this operation, he has several years of clinical practice, several years of training. It's not just for anyone to pick up a knife and say, I'm going to do an operation for you. No, a specialist is usually involved in this matter. So we mentioned retrograde ejaculation. Instead of the semen to be coming out, it goes back into the bladder and comes out with urine. So this is uncomfortable for men. However, so
when the man is urinating, does he actually see the sperm coming out with the urine?
It will be a mixture, of course. Like seminal fluid and urine is a mixture together. So it's important to inform the patient beforehand. There's the possibility of this happening. You need to know what you may experience, if at all, so that there's no fear. You don't begin to worry. If they told you something has happened, you are kind of psychologically prepared for it, unlike when you really don't know what is the next thing. Another side effect that we've seen is erectile dysfunction, but this is not very common. It is important to enlighten a man that there is a risk that you may not be able to perform, or you may not have a strong erections. It is important to enlighten the man, but it's not very common.
Most men don't like to hear that something is going to happen to their ability to perform when it comes to sex and all that. So do they, or would that patient lose, would that patient have erection afterwards, or will not have at all again?
The reason we tell patients this is there's the possibility of it happening. It can break from weak erection.
Is that how it's going to be, or it's going to be for a while? Maybe say 2 months, 3 months.
For some people,
4 months, or it's just going to be like that. It may just go on. There's really no remedy for it, which is why you need to inform the patient that this is a possibility. In spite of this side effect, you have to be alive to even perform. So you cannot leave the offending organ there in the name of this man has to perform his marital duties. We've seen patients who turn down operations because when they hear, I cannot. In fact, some will tell you, some will tell you, I rather die. We know, we understand. It comes with a lot of counseling, a lot of psychological issues. Yeah, they feel that there are no more men. And there are no drugs to help them after
for that. No, because it's the way it happens is not a medical thing. It's not something that the drugs are going to rectify. If not, it shouldn't be much of an issue. We just look at the benefits and look at the risk. If you don't do this operation, what are the possibilities? If a man is crippled from a metastatic cancer, you still would not be able to perform. So isn't it better you're alive and well and look for other ways of pleasuring the woman, at least to perform your duties to a point,
I'm just wondering
than not being able to do anything at all. It's usually for the male reproductive health, it's always a dicey issue. I've had the opportunity to do some studies with men, and people, they don't talk about it. They don't complain. They don't tell you anything. If it is detected early enough, maybe, for example, you are beginning to see an enlargement early enough, you can be placed on drugs and to reduce the growth. So the patient is not likely to get to the point where they need an operation. But because of late presentation, these men don't come out. They don't say anything. In fact, it's when they begin to have issues and the woman is asking, honey, are you not done with the bathroom? Okay. The man says, I'm coming. He's the kind of person that you are traveling in a bus and then, okay, you never finish. I'm coming. This is because he has to stand and wait for it to come. And he's straining. And even by the time he feels he has finished urinating, there's still that incomplete feeling.
Yes,
I still have something there. So he's waiting. The effects on the life of the patient, the effect on his daily living, I don't think if you have an understanding wife, at the end of the day, it will be an issue so much. Most times, women want you alive. Be with me. This is what we have to sacrifice for you to be alive, to watch your children and stuff. I don't think it's so much of a problem. But men don't talk, which is what we are trying to counsel men. If you're having any issue and you feel you don't even want to maybe discuss with your friends, go and see a doctor. A doctor is sworn to confidentiality to keep any information you give between yourself and himself.
That is your secrets are safe.
Your secrets are safe. He's not going to go outside and see you in the beer parlor and say, oh boy, is he working? No. These are some of the things. No man wants to feel that he's not a man. Yes. And these issues, because they revolve around the ability to perform, the bedroom matters, being manly and macho and all that, they try to conceal it, and it is wrong. So it's important, if you have any challenge, if you have any issue, and you don't know who to talk to, don't call that your friend, because he may use it to laugh at you tomorrow. You should actually just go to a doctor and explain all the challenges you're having. And you see that you'll really be better for it.
You know, sometimes when you're driving through motor parks, you see a couple of men gathered. Then with this people who sell one concoction or the other, give me Tidebe, give me strong one, give me this. And you begin to wonder, are these people really aware of what they are doing to themselves with all of these concoctions that they don't know where they came from?
Well, sadly, I think for them, will I call it peer influence? One person is taking it, you want to, yes, and they give you feedback. Sadly, this feedback a lot of time are false. Some of these men know what they are managing. Some of these men are on drugs. Some of these people who even tell you and form macho are on medication constantly, but they never come out to say these things. So you who is having one problem at the onset, you are being lured by the picture this man is presenting to you. Meanwhile, it's a totally different ballgame entirely. When you begin to take that herbal medicine, one cup, they have all sorts of names for it. Yeah, it's to the detriment of your system. At the end of the day, it's sad that the person who is giving you the advice is doing something totally different. So, we advise men.
Okay, now let's look at the newly diagnosed before we go. How do you talk to this person? Because some of them usually are not themselves. The moment they hear that pronouncement from the doctor, my friend, you know you doctors, you have a way of just saying the thing. You will just say it. You just have to say it, you know? And then you have a way of keeping your face, and then you will say it.
Well, we've been taught to empathize. You have to be as blunt as possible, but part of the training is for you to be able to give the patient hope. I tell my patients, you should thank God that this was detected. Some people don't have that chance. Some people don't have the opportunity to get to the hospital. At times, it's the complications that they come with. They say the man hasn't been able to urinate for a few days. Then after a while, he couldn't walk anymore. By the time they got to the hospital, he was in pain. And you find a bladder that is full. He's having that pain because the bladder is distended. And then there's already a metastasis to the spine. This man cannot walk. You are beginning to talk of other things. So the first thing is, you should be grateful that we've been able to make this diagnosis. You should be grateful that there are options. There are things that can be done. And when we go through the normal process of stepwise trying to find which category you belong to for treatment, it shouldn't be a problem. It shouldn't be a problem. So for counseling, we tell you about all the treatment modalities. We tell you about all the treatment modalities. We tell you about the side effects. And then we also try to encourage you. If you need to bring in your spouse to be spoken to, no problem. Bring her in. Any other person who may want to fund an operation, if it's there, bring the person in. We try to bring everybody into the picture because your care is for everyone. Even this family history, your sons should know that this thing has happened to their father. When we get to this age, they just have they need to begin to check.
So with treatment, management and all, the person can live a normal life.
Yes. Yes, I tell people these things are not written on your forehead. If you don't tell someone that this is a challenge you are facing at home, they wouldn't know. So don't write it on your face.
All right,
just
thank you very much, Dr. Ogale, for finding time to be with us on the program Healthy Living. And I know that a whole lot of us will want to, do a follow-up call because some persons don't want other persons to hear their voices that, oh, so person is calling. All right, call this number 081-8494-5838, 081-8494-5838. So I've been talking with Dr. Ogale Osula, Public Health Physician and Chief Operations Officer, Reta Council. Thank you very much, Doctor.
Thank you very much,
for being on the program.
Thank you.
All right, guys, we're going to see you again on Monday. Until then, let me use our local balance. Because go to the hospital if you're a guy and you're above 40, and especially if there's a family history of prostate cancer, go and do a checkup. With treatment, adequate management, you will still be able to live a normal life. And early presentation is very, very important and very key to your getting well. We'll see you again. Bye-bye.